Hi, I'm Dr. Ramsey Choucair, a board-certified plastic surgeon with over 20 years of experience with facial rejuvenation. Today, I want to clear up one of the biggest sources of confusion in plastic surgery. What exactly is a facelift, and what is it not? Well, understanding the different types of facelift is crucial when deciding what's right for you, and a surgeon will help you make that decision. When most people hear the term facelift, some may assume it means a complete overhaul: your face, your neck, your eyes, and your brow. In reality, a facelift most often focuses on the lower face and the neck, from the cheekbones to the jawline to the collarbone. That's the most common facelift term that I believe exists. But the term facelift can be vague, and in really describing the areas that are rejuvenated, it can be confusing. Here's the most common types of facelifts. The term I use the most, lower face and neck lift. It is the most common term because it describes what we're treating. It addresses sagging skin in the lower face, the jawline or the jowl, the neck tissue. It's the most popular choice because that's where most people age the most. Then there's the term the deep plane or the SMAS lift, a more advanced technique that lifts the deeper tissues for a longer lasting natural result. The terms are somewhat used interchangeably, and the fine details may be even confusing to experienced surgeons. The bottom line is a two-layer facelift, skin and the deep tissue, is considered the most long-lasting and natural type of facelift. As a seasoned facelift surgeon, this is the most reliable technique, utilizing the deep tissue and the skin. Now, a mini facelift addresses aging from the cheekbone to the jawline, but really doesn't affect the neck. It's usually for younger patients. And a mid facelift focuses on the area around the cheekbone and the lower eye, and sometimes it requires eyelid surgery, and sometimes you restore volume to improve that. And sometimes the lower face and neck lift technique improves the mid face. And of course, the neck is one of those areas we must treat with almost any significant aging to recreate a more strong jawline and help the aging in the neck. And then there's eyebrow lifts and brow lifts. Now here's an example of a patient who underwent everything. She had a brow lift, she had an upper eyelid lift, she had a lower eyelid lift, and she had a full lower face and neck lift, and this is several years later, showing you that even a full facial rejuvenation can look very, very natural, but not everybody needs it. One of the most important things to understand is that no two facelifts are often the same. There's some basics. So what are the basics? Well, it's about being balanced and natural and having a harmonious result. So you have to deal with the skin surface, the wrinkling, which may not be completely dealt with a facelift, the skin laxity or the sagging tissues that you're lifting. You have to deal with fat and facial volume, which can be excessive or not enough. And you have to deal with the muscle relaxation. And that's precisely what the deep plane or the SMAS, superficial muscular aponeurotic system, deals with. It's critical that the surgeon tailors the approach based on your unique anatomy, your skin quality, and of course your personal goals. Another point of confusion is the term full facelift. And as we mentioned, many patients think this means a complete overhaul: the eyes, the brows, the neck, and everything in between. In reality, a full facelift typically means addressing the lower face and neck. Additionally, adding eyelid surgery, brow lifts, or other procedures may be necessary to achieve the patient's goals, but we typically call it what it is: an eyelid lift or a brow lift. And the facelift is usually the lower face and the neck. The key is to match the procedure to the patient's specific aging pattern and expectations. And again, it's the surgical judgment that matters most. The bottom line is that a term facelift can mean different things to different surgeons and patients. So you just want to make sure that you and your surgeon are speaking the same language when you're planning to do any facial rejuvenation procedure. This is the best way to ensure that you obtain the results that you expect. Thanks for watching.